analytics is so foundational to everything we do in care, and especially value-based care. So give us an idea of how a new measure or metric goes from idea to operational dashboard in your organization. How does the idea get off the ground, get approved, assigned resources, built, and then operationalized?
It's a good question. So I'll start with, we're not unique in that we use steering committees and to help drive what needs to go into the tool sets that we utilize. So obviously you're going to get the regulatory and compliance things that get handed down. Hey, there's new HEDIS measures. Hey, there's new P4P. Hey, there's new stars. Hey, there's new things we need to be thinking about. That all goes into basically our think tank of this one steering committee. We figure out what pieces need to go into what we call the physician intervention, or the physician information portal, which creates our patient intervention reports. Like, these are the things you need to be talking to your patients about, et cetera. It's always this think tank of ideas and sharing what's coming. So we're fortunate. We've got people who sit on APG. We've got people that are connected with all of our health plans. We're kind of all over the state, and we bring that information back into our organization and be like, hey, this is the requirement, but then how are we going to do more than just meet that? So we are not in the business of checking a box and meeting a requirement. We're like, here's why it exists, or here's what we need to be doing, and here's what that looks like in our organization. So our goal is always to create what we think are the exceeding metrics that go along with that. And there's a lot of creativity that goes into that. So that's why so many of the things that we've built, anybody who's been a part of a healthcare organization for a long time knows that what I call the sort of organizational architecture of how your systems are built, it looks like, we call it spaghetti diagram. And it literally looks like that. It's a beautiful diagram, but I'll tell you, it's like a board game. There's so many pieces and connections and parts and things that have to work well. That now we've also learned that not only is it important to bring an idea in, how we're going to build, design, test, implement, maintain, et cetera. Do we buy versus build? Who's going to manage it? What does the reporting functionality look like? How are we going to use the data? How do we refine it? It's also, how are we documenting this so that we aren't creating a monster for ourselves? We almost have to think about that internal interoperability as we build for the future.